Hello, my friends. We're going to talk about it. We're going to go for it. The topic, this one's a hot button one. I have to really wake up and wait until I feel like I want to tackle this today. I would like to get yelled at on the internet, is essentially what I need to say to myself. Today, we are going to be talking about should nurse practitioners who have their doctorate call themselves doctor? I guess not should. Would you? Would I? We're going to be getting into that here. I do want to say before all of this starts, if we're meeting for the first time, hello, welcome. I'm Liz. I'm a family nurse practitioner. I do not have my doctorate. So some may say that that makes me unable to have this conversation. I disagree because I could imagine that I would, and I know what I would do anyway. And this is going to be a hot topic. This is something that has been raging back and forth for many, many years. There is probably objectively no right or wrong way, technically, although that's not true in some states. Some states actually have laws saying you cannot do this. I'm very happy to hear both sides. I would love to have conversations about both sides. I hope that continues live and in the comments. But you have to be kind. You know what I mean? We have to be kind about this conversation. We have to at least be civil. Okay. So if we see any shenanigans, mods, if you could just like get that right out of there if you see it, and I'll be watching them too. But I'm going to go through my point first, and then we will kind of have a discussion about it all around. If you're here live, hello, welcome, welcome. Let us know today did you do anything fun? What was the best part of your day? And hello, if you are part of our replay crowd, hello, welcome. I'm glad you're here. I will have timestamps, however, that'll probably go up like tomorrow. However, I think that I don't even know if there really will be timestamps for something like this. So that's what we're going to be talking about today. We're going to be tackling the topic. Maybe this will be the beginning of our tough nurse practitioner questions that we cover, such as should they have more clinical hours? Should we have more clinical hours? Should totally online NP programs be a thing? What's wrong with NP school? So and so. Let's see. Like I said, we're going to have lots of opinions. And as long as you present yours respectfully, I'm all about that. Ready, set, let's go. All right, night shift crew. Let us first start by looking at some of the best things that happened to people today. Okay. I think that's the best way to start things. The best part of my day was I'm really loving my Disney Dreamlight Valley. I started a streaming channel just to stream that game. It's very fun. If you want to watch me do that, I will leave the link later down in the bio. Very good time. Just relaxing and fun. Nothing stressful. I could see it becoming very addicting. You have to decorate your house. You go on adventures and you find different things. It's based in Disneyland that was taken over by evil vines. Your weapons are shovels. You do all of the things. It's very, very, very fun. Rogue NP, hello, welcome. Thanks for being a channel member. I appreciate you. Best thing today was Mexican food, carnitas. Yum, 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 yum. Let me see. Cody Esterline says, I'm studying. Oh dear, alpha and beta cell blockers. That is trouble. Mr. Midwife, hello, Chad. He delivered a baby at 5 a.m. Much better than 2 a.m. Happy birthday, little baby. Happy birthday. Rogue NP said started playing that. Minorly obsessed. Majorly obsessed over here. Majorly obsessed. And Mama Nurse, we are on, oh no, hurricane lockdown, but thankfully I'm not working right now, so I'm home with my family. I hope everyone in the path of hurricane, I forget what it is, Ian, maybe. I hope you are safe. I hope you are, if you're working, goodness, I hope that goes quickly and that you have as much power as possible for all people and that it's just safe. And let us know if we can send you pictures of, I don't know, something cute to make you feel better. I hope you're okay. And yes, everyone stay safe. It's going towards, I think, Orlando, right? I think so. June Same says, best part of my day is my house not being destroyed by a hurricane in Florida. Who's down there? Who's in Florida in the path of this hurricane? Oh, that's just stressful. Hurricanes are not a natural disaster I've dealt with. I've lived in California with earthquakes. Okay, that was a lot. But I was used to them. When I was in college, we had an earthquake on the East Coast, and there was an earthquake, and I just kind of it wasn't a big one, so I didn't even register it. I was in the library. All of a sudden, everyone started running out. I was like, that wasn't even oh, that was probably a 4 because you rate them on the Richter scale, and I was like, why are we panicking? I forgot where I was. I was like, I am in Delaware. This is abnormal. Hurricanes. Don't know about those. And I can deal with like, I don't know. Can I deal with other natural disasters? I don't like tornadoes. Tornadoes are one of my biggest fears, right up there with fires and dying in one. So that's a little bit about me on this dark Friday night. So let us dive right in. Okay. So, do I think that nurse practitioners should use the title doctor in front of patients, even if they have their doctorate? So, let's just take a step back really quick and understand a little bit about nurse practitioner licensing and everything kind of surrounding that, right? Um, when you're a nurse practitioner, you can either have your master's degree, your MSN, that's what I have, or your DNP, which is your doctorate of nursing practice. That is not a, having your DNP does not make you an NP. A lot of different people like CRNAs, midwives, people, I think maybe even in other areas can have their doctorate of nursing practice. It's very confusing. I have a whole video on it. I'll link it. But the big thing is the powers that be would like to make the doctorate the standard for nurse practitioners, right? The big question is, are they ever going to do that? I don't think so. That's been trying to do the same thing with nursing, with registered nurses, trying to, make sure, like, make it so the registered nurses all have to have their bachelor's. And they've been saying that for what, decades and decades, and it's never moved along. It's just not something that a lot of schools would lose a lot of money, essentially, because a lot of people wouldn't want to go for the doctorate and it's just a huge pain. So they don't enforce it. So they keep saying, like, oh, soon we're going to have to make it the doctorate. And then it gets pushed back. Currently, their goal is 2025, I think. There's no way we're going to make that. Nate, there's too much money, not enough placements in school. Yeah. So the schools, I mean, they're already like struggling because nurse practitioner schools just open their doors to everyone. They're like, do you have a pulse? Welcome. Come on in. Not all of them, but a lot of them. And so that's kind of where it's coming from. So some nurse practitioners do have their doctorate. And however, I do not think that nurse practitioners should call themselves doctors to patients. I don't think that that is helpful. I think that's confusing. I totally think in a different setting, if you're in an academic setting or you are among peers, call yourself doctor. You earned that title. And I'm not in any way saying that you didn't earn the title with patients. I'm saying I think we need to reframe and focus on what really matters here. Okay. Because when we're introducing ourselves to patients in healthcare as it is right now, when we say doctor, they assume you are a physician. In the perfect world, I think that, everyone who has the doctoral title would be able to be called doctor, but we're not there, friends. I'm telling you, having worked as a nurse for 6 years and a nurse practitioner in an office for 3 years, I could barely get the people who I took care of all the time to understand that I was not a medical doctor. I was not a doctor at all. I was a nurse practitioner, and these are people I took care of all the time, right? Patients are confused, very understandably, because the healthcare system is very confusing. We have so many different people coming in. We have, physicians, and then we have PAs and nurse practitioners, and no one knows who we are at baseline. No one even has a clue who we are at baseline. So that's confusing to them on their own. That's going to need to be explained. There's so many different types of nurses. Everyone wears the same thing, right? We all walk in like scrubs and a t-shirt, and no one knows anything, like who anyone is. We're bad at introducing ourselves, or we say who we are, but we don't explain that. Like, they're just like, oh, okay, that, like, what do you even like do? And it's a confusing healthcare system for people that work in it. I meet people all the time in healthcare who introduce themselves to me after I've worked in it for more than a decade, and they say who they are. And then I'm like, I don't even know what that is. So if healthcare is confusing to people who are inside of it, I don't think that we need to make it any more confusing. Okay. I think that when patients, because historically this is how it has been, if a patient hears doctor, they are going to assume physician. And that's just, in my opinion, how it is right now. I do not think it is fair to introduce yourself. The point of an introduction is to Make your identity very clear in an already stressful situation, right? Because patients just want to have a really quick, like, hey, this is who you are. And I think it is, first of all, patients, if we're being totally realistic, and this is not a knock against patients, this is when someone's interacting with the healthcare system, it is stressful. When I interact with the healthcare system, despite being very involved in it, I think it's stressful. You don't hear everything that the provider in front of you is saying. You do not hear it all. So a lot of times you might hear Dr. So and so. If you walked in, you're like, I'm Dr. So and so, the nurse practitioner. There, that's likely going to be something they're going to hear doctor and they're like, okay, perfect. Like, I'm not hearing really necessarily the rest of that. And I have seen several times patients feel very, 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 very misled when they're had a, I precepted with a nurse practitioner who had her doctorate, and she was very insistent on using the title doctor. And until this point, honestly, I was like, well, I would call myself doctor too if I had gotten one, because I would be like, oh, I earned this. And that was kind of what school told me. Everybody in school was like, you should absolutely call yourself doctor if you've earned your doctorate in a clinical patient facing setting. Again, I have no qualms with anyone calling themselves doctor when you are among peers, right? So if you're back in the back office and they're like, you want to be called Dr. So and so, sure. If you are at an academic setting, if you're in a clinical setting, if you're at a conference, if you want to write it on your lab coat, if you want to write it on your door, right? You do you. You earned it. But I'm talking specifically about, I think when you're introducing yourself to a patient, it's confusing, right? So I was working with this person. I did a lot of clinical hours with her. The number of times that she would introduce herself as, hi, I'm Dr. So and so, a nurse practitioner here. Patients did not hear a nurse practitioner here part many times. I can count at least 5 within the 1 year that I was with her, that patients that I knew of and I was helping take care of were absolutely irate. Because they thought they only wanted care from a physician, which is fine. Patients are more than welcome to have that opinion. Never take it personally, friends. Just let them do it. And they heard, I'm Dr. So and so, and they thought, oh, okay, good. This is one of the physicians. Did not even listen to the nurse practitioner part. They didn't even know, it turned out, what that really was. And in the medical system, we don't have a lot of time, right? You have 15 minutes. I don't want to waste any of those precious 15 minutes going through and being like, did you understand what my title meant? You know what I mean? Because the goal of a title, in my opinion, is simply to communicate very simply your role. I also hated when you had after your name, this is just a personal thing, Liz, and then people would put like RN, BSN, CPN, like all the things, because I just wanted it to say Liz, nurse. Very simple. That is who I am. You can read it very quickly, right? So these patients ended up getting incredibly frustrated with her. It turned into a huge thing where later, a few months down the line, they didn't find out until they saw it on paperwork. They're like, what is this FNP C thing after your name? She's like, oh, it's because I'm a nurse practitioner. They're like, wait, you're not a physician. You told me you were a doctor. She's like, I am a doctor, but I'm not like I'm not a medical doctor. I'm not a physician. And it did not go well. And that really, I saw that enough times, and I saw that at more than one location. And I very much in this twisted to be like, oh, like this is something that we could make simpler. And I think when it comes down to it, using the title, hi, I'm Dr. So and so, you're a nurse practitioner, has a lot of room for misunderstanding in a healthcare system where patients already feel misunderstood and in a misunderstood and just manipulated, right? A lot of people feel really manipulated. A lot of people feel like the healthcare system is not on their side. And we just want it to be simple, right? So that's my take on it. I think that when I'm talking to patients, it doesn't really matter what my title is. I just need to communicate my role. Again, I don't have my doctorate, but if I did, I would never use it with patients because who cares? You know what I mean? At the end of the day, I'm going to be taking care of this in their role. I like the people I want the respect from are more of my peers, but even then, I don't care if you call me doctor. I don't get my validation, from having someone call me a certain name. You know what I mean? I get it from my job and what I do and the satisfaction from that. Physicians, and the argument I've heard a lot is, well, I earned this, so I'm going to use it. If physicians can use it, so can I. That's going to help them respect our profession. That has not been my experience personally. I have not seen physicians respect nurse practitioners more. I've actually seen the opposite. When they're like, oh, well, I have my doctorate, they're like, we are not the same. And I think I've talked to a lot of medical doctors actually about this. And I said, what is this trouble here? Why do you feel so attacked because they really hate it when nurse practitioners introduce themselves as doctors, mostly because they feel like it's confusing for patients, but also because it allows for a lot of confusion, right? And they said that it makes them feel like, which is, I mean, I'm not saying that this is like, okay. I just think this is kind of where my hesitancy is too, is it makes it really easy to confuse the two. And nurse practitioners and physicians are very, very, very different. Right. And I think that's where the confusion can lie. And that is also why some other specialties are able to use doctor much more fluently, right? So if you have let's say a psychologist, right, who has their doctorate, they are not a medical doctor, they have a doctorate. If you're going to a psychologist, you usually know that that is not a medical doctor because that is in a totally different setting typically. And I think in that setting, they could be like, I'm a psychologist. Here are my credentials. They're doing a very different role, usually, than a psychiatrist. And like, hopefully, they've explained that well. But there are not as many blurred lines there. They usually know I'm not going to you to receive medicine. I'm going to you for some kind of probably an evaluation or maybe therapy. When you're going to a nurse practitioner or a physician, the problem is they are very, very similar roles. We both assess, diagnose, and treat. And if we're in the same setting, we're assessing, diagnosing, and treating the same things, essentially. So the roles are very similar, which is why we have to be very, 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 very clear at what is happening. And I totally think that patients hear probably 25% of the things that come out of my mouth. And that is the people who are listening, because it is an overwhelming experience. This is a lot for people to take in. This is not, we use a weird language. Our offices are usually intimidating. They're nervous. They're thinking about all the questions they're not feeling brave, like they are comfortable asking. They're thinking about, what does this mean long term? Most of the time you're telling them information that could be scary. Mr. Midwife says 25%, that much, huh? I know. I'm very optimistic there. And I just think that it's in a situation where there could be a lot of confusion, it doesn't help. Okay, so that's my kind of basic take on it. If I had my doctorate, I would use it maybe like on, I'm different. I wouldn't even put it on my like anything. I would like sign my name with it if I wrote an academic paper, or maybe in my signature, but I don't care if it's on my coat. I don't care if you put it on my door, like whatever, who cares? That. So that's what I think. I am curious to hear what you think. Let me put a little timestamp there and then we can come back. I'm going to make a quick poll and let's see do you think nurse practitioners should use doctor with patients? Yes or no? Let us ask our community. So that's what we're looking at. Let's go back. First, good news. Good news. Iliara Rigodanzo got accepted into nursing school. Congratulations. That is very, very, very exciting. Very, very exciting. Congratulations. That's really hard. That's a difficult thing to get into. Those are very, very crowded institutions. So going back, we have some of our crew. Let's go back and see. I think Mama Nurse had said, Oh, I get to go way back to the beginning. Mama nurse says, nope, I don't think they should use the doctor title. Too much confusion for the patients and for family members. So yes. Shane XM says it's misleading to patients. Doctor in a medical setting very clearly means one thing. Nurse practitioners did not get nearly as extensive medical education. Very true. I think this could change in the future, but not now. Yeah, I think there would have to be a lot more public education starting a lot younger, which I think would actually be helpful. I think in high school, why in public high school are we not educating on this is how the healthcare system works? This is how insurance works. Hey, did you know that the physical therapist not only exists, but has their doctorate? Hey, did you know what a nurse practitioner is? And just have a basic course because the number of people who landed in my office who were like, I was like, hi, I'm Liz, I'm a nurse practitioner. They were like, you're a nurse? I'm like, yes, I'm a nurse. But then I also went to school for a few more years and learned how to assess, diagnose, and treat patients so I can prescribe you medicine and diagnose you. And they had no idea. They're like, so you're in med school? I was like, no, no. Hold on, let's back up. So there's very much not a general understanding going forward with that. And yeah, that's what I think. Rogan P said it's true they earned it, and for a long time, doctors or scholars who earned the title, not medical providers alone. It has become common practice amongst the general population to associate a doctor with only a medical doctor, not those who have achieved their doctorate. Yeah, I think the setting is incredibly important as well. If you are at a pharmacist, if you're at a pharmacy and someone says, or you're approaching a pharmacy, right? Someone will usually like, they might be like, oh, let me go get the doctor. If you're at a dentist's office, they're like, oh, let me go get the doctor. You are in a setting where you think, like most of the time, people are like, oh, okay, I'm in here. Like the doctor is probably the pharmacist or the dentist. It is once again, because that is the person who is kind of at you know, the top of the tree in that setting. And so there's not as much competition. If there happened to also be a medical doctor in the pharmacy that worked there, that would be very confusing. And people would probably default to, oh, the medical doctor is there's the doctor and the pharmacist. Who even knows? Who even knows? You know what I mean? Just my thoughts. Mr. Midwife said, never in a clinical setting, behind a podium at a lecture, sure, but never in the presence of a patient. In a few months, I graduate with my titles to be Mr. Midwife, CNM, DMP. Okay, good. So someone with a DMP soon to be agrees with me. I always feel bad like talking about it and then people get mad that I do talk about it. I'm like, I could imagine that I have my DNP and I did do a full 180 because let me tell you, in school, they really shoved it down your throats that you earned it. You should use it all the time. And after seeing that fall out, I was like, oh no, even if I ever did that, which sounds like a terrible idea. That sounds like awful. Different conversation about, is the DNP worth it? Maybe I should. I'm going to do that one on a panel though, where I have people with their DNP because that feels very biased for me to be like, no, without backing it up. Unless you want to teach, I don't think the DNP is worth it because you do the exact same job. But if you want to teach, there's that. Let me say, Anabon says, I think it's easy to say I'm Dr. X. I'll be your nurse practitioner. If a patient needs clarification, they'll ask. I just don't think they'll listen. I don't think they'll listen, or I don't think they will ask. I don't think patients ask. I would say patients don't ask almost most questions that they have. I have found that I really have to pry it out of patients in order to get them to actually ask questions. They have to be very comfortable. It is not patients do not ask a lot of questions. They're usually scared. They don't want to seem, you have to be very comfortable if you think about it to ask a question because you don't want to look dumb. You don't want to look like you're asking something that is inappropriate or that you're needy or you're doubting them. Or in my experience, that's what it's been. Very few people asked me what a nurse practitioner was. So I started eventually asking, are you familiar with nurse practitioners? And everyone said no, but no one had ever asked me, what's a nurse practitioner? Maybe one person ever. So do you really think that if you say, I'm Dr. So-and-so, I'll be your nurse practitioner, that they would ask? I don't think so. I think most people would be like, oh, okay, like, let's use that and we'll see. But I don't think they would understand their role. And I think it's a patient's right to understand exactly who they are seeing and who they're being taken care of, because there is a huge difference in training of physicians and nurse practitioners. And if a patient wants to see a nurse practitioner, or a physician instead of a nurse practitioner, that is very much their right. And this would be the same thing with PAs. I would say the exact same thing to PAs. There's just fewer PA DNP programs or fewer PA doctoral programs. So it's that. Audubon also says, I think it's a personal choice and practitioners are required by law not to represent their qualifications. So the debate is really a moot point. If an MP uses doctor, they must do so and clarify. Yeah, this is more of like, but do I think you should? This is literally just my opinions. Some states actually say you cannot. Some states have declared that it is too confusing and that in a clinical setting, even if you have your doctorate as a nurse practitioner, you may not use the term doctor in your title. Like when you're introducing yourselves to patients, you have to just say, I am a nurse practitioner. You cannot have the doctor in there because it is too confusing. Um, Unanimous says absolutely not. Jerry says DNPs need to educate patients on the differences, but in what time? That's my problem with it. I have 15 minutes with you. You have not come to me because it is so expensive to get into healthcare, right? So I would have my patients coming to primary care. They've waited months until things have gotten bad because their deductible is $7,000. So they're going to have to come here and pay the hundred and some to see me. So they've waited to try to clump everything together. They have come in, they have 15 minutes. Their blood sugar is crazy high, their blood pressure is crazy high, their foot has been so sore for so long, now 3 of their toes are numb, they can't rotate their right shoulder, and they've had a headache, like debilitating headaches for weeks. And this is a 15-minute appointment. They cannot afford to come back. I do not have time to sit there and educate you on the differences between a DNP and a doctor, a medical doctor. You know what I mean? And that is when I think it is just confusing. Or when you're in rounds. You know what I mean? If you're in the hospital and you're in rounds, that's so fast. You don't have time to sit there and be like, oh, hey, this is the difference. In a perfect world, I agree with you. We could be like, I'm Dr. So-and-so. I'm a nurse practitioner. So like that means I was a nurse and then I went back to grad school and I completed my doctorate there. I am not a medical doctor. Okay, if you could do that, but it doesn't, like, it's not assuming that patients, and then they said we can't assume like patients are incapable of not understanding the differences. I think it's just an amount of education that we don't have time for at the moment. You know what I mean? And this isn't to like attack your what you were saying or anything, just to kind of give you pushback on that and say like, oh, I don't really think so. And Jerry also said physicians should refer to themselves as I'm your physician, Dr. Smith, if they want to be direct. But in reality, are they going to? No. You know what I mean? We have to kind of work in the system that we are in at the moment. And this is the other part of this, like in a perfect world, could we fight this fight? Yes. But there are so many bigger issues like the $7,000 deductible that made it so that none of my patients could seek care, or the fact that even when they did pay that deductible and they hit the $7,000, their insurance company still wouldn't cover the first line treatment because it was more expensive and they had to go back and fail other ones, which just delayed their care and made them even more sick and more likely to end up in the hospital and long-term disability. That to me is such a bigger issue than who are we calling doctor to patients? You know what I mean? And like, I would so much rather spend all of my energy focusing on that than other things. And like, if I'm going to educate my patient, I would rather educate them on how to pair a carbohydrate with a fat so they're full longer, so they don't reach for snacks that are just going to fill them up right quick and then go back. I'm going to teach them how their heart and their lungs work and how some simple ways that they can move their body without even leaving their house that they could work on. Or, hey, pick this, not that. Hey, did you know that all of those supplements you're buying, like, please don't do those. Hey, we should stop smoking. You know what I mean? Things like that, and meet them where they're at and go from there rather than fight about this or waste time educating you on how I went to school, because how I went to school doesn't matter. You know what I mean? Like, to them, they just want to know, how can you take care of me and can we do that? So there, additional thoughts. On a Bunsen, I think a lot of people don't understand that some MPs have doctorate degrees and some don't. All doctor means is terminal degree, and no NP would ever be confused with an MD, so they can clarify. The people do get confused though all the time because it's a very similar role. You know what I mean? And we all, like in the hospital, everyone goes in and they wear a white coat, and a lot of people look the same. It is like, and it's not the patient's fault that they don't know, but there is a a ton of confusion there, having lived it. A ton, a ton, a ton. In a perfect world, no. But again, we are not living in a perfect world. Victoria Bay said, absolutely not. If you did not do the MCAT, study biochemistry and get into med school, then you didn't earn the MD. Doctor, what's wrong with using PhD, APRN? I just don't feel like people know what the letters are. And I have, like I said, no problem. If you are in a setting and you did earn the title doctor, use it with other people who are going to understand it. You know what I mean? Who understand what DNP, APRN, FNPC means because DNP is your degree, APRN is your license, and FNP is your certification. And that makes sense to probably not even physicians. They probably don't know what all those letters mean. I don't know what all the letters after their names always mean, but yikers. If I can barely understand it, they can probably not understand it. Rogan P said, I wonder if there's a legal question about using doctor, brushing up on the requirements for NPs in Washington. And there's a rule about who can and who cannot use the title NP. Is that the same with doctors? I don't know if Washington I should have looked up what states you cannot call yourself a doctor if you, as a nurse practitioner specifically. But this is slightly different. Most of the rules about nurse practitioners are you can't call yourself a nurse practitioner until you have passed your certifying exam and have been licensed, at least in the states that I have worked in. But this would be a totally different thing. And it targets specifically nurse practitioners and physician assistants and says, hey, you can't do this. It's too confusing. Tristan Barton said, I'm going to mark this as a question for later. And we'll do questions that are off topic, but related or whatever at the end, just to try to keep this somewhat contained. Anonymous said, patients have no idea what a PhD DNP is. And when you say doctor, they assume you're a medical doctor. Reserve it for medical doctors. Yes. Hi, Tammy. Too much money, not enough placements in school. Dustin Lamb says, Siri's talking to me. If you went to school for 7 to 8 years as a DNP, you earned the title as long as you clarify your role, in my opinion. I think I've explained why that is not my opinion, but you are welcome to it. Nate said, we shouldn't assume patients are too dumb to understand differences in qualifications and scope of practice. I think it can be handled in a case-by-case basis, in which case it's not confusing. The only case I could see this working personally is if I was talking to someone else who was medical. But in that case, I just wouldn't care either. I'm not going to change my spiel for you. But I don't think it's assuming patients are too dumb. I think it's prioritizing what I want them to remember on that day, understanding that they're going to take away very little of what I'm saying realistically, just given, again, my experience. And I don't care if them knowing about what my degree is part of that conversation. I'm I would rather you remember so many other things. You know what I mean? But if you don't want that, that's totally fine. I'm going to save that one. Annette Q, I agree with Liz. I knew I liked you. Just kidding. You're allowed to disagree with me. Everyone is allowed to disagree with me. I'm just going to fight back because I feel very passionately about this, but that doesn't mean that I am wrong or you are wrong or I am right or you are right. It just means we're able to. I follow a law channel called, I'm blanking on the name, but the host he always says reasonable minds can differ. And I like that. I'm yes, we don't have to agree. When did we get to the point where we were I have to be right about everything? We can have different opinions. Virtual legality. That's the name of it. Great legal show, by the way, if you're interested in that. They break down popular Rick Hogue. Yes. Farm Nurse Doc. He's the best. Steve Leto. I've also heard of him. There's some great law too. It's been very interesting diving into, I've been watching a lot of law type of things, trying to understand how does the law work? Because when I was reading into all of those the cases that I've been covering on this channel. Yes. Hogue Law. Okay. Yes. Thanks, Thomas Brown. Hogue Law. It is so much more helpful to have some kind of a background of law. So I've been watching all of those. So that's a rabbit hole I've gone down. And it's very interesting because the law is a wacky place. Mr. Modwife said, never in a clinical setting behind a post. We read We read yours. We read that. Rogan P. Yeah, we're not assuming patients are dumb. We're assuming that patients have been preconditioned with 200 plus years of a habit to associate a doctor with an MD, not people who have a doctorate. That summed up this entire video very well. Thanks, Rogan P. We could have just said that. But then we wouldn't be here 35 minutes later with me saying the same thing over and over. Very well said. Let us see. Anonymous says, if you're very proud of your degree, call yourself by your name or get a different degree. I love that. I feel this. This would be me on a when I'm just like being very straight to the point and honest. I'm curious on your thoughts because of the recent PA name change to avoid patient confusion, physician assistant to physician associate. Why do you see the NP name changing? No, I honestly think physician associate made it even more confusing because now it sounds like they're just someone who works under like an associate of them. So like, what does that even mean? I have not seen physician associated become widely adopted. I've talked to some PAs. If you're a PA and you know about this, let me know. But I have not seen it widely adopted because in my opinion, and the opinion of many PAs I've talked to, they were like, this is like no better. And it's not widely adopted because insurance has now, they have not written it into their terminology. So the PA board has like, in case you didn't know, physician assistants decided their head physician assistant people were like, oh, we're going to call ourselves physician associates because it's going to be less confusing. But it's like not that at all, in my opinion. So they've decided that, but insurance companies have not written. They have to write into all of their policies, physician associate can do this, can do this. So it has not been implemented yet, technically. And I'm curious if you guys know, like, if you're a PA, what do you think about it? What have you heard on that? The ones I know are not thrilled because they're like, that made it no more clear. Absolutely no more clear. Yeah, Mr. Midwife PA now equals like, it almost sounds more like, are you an MA? Like, what is happening here? What does associate mean? This sounds odd. Nate says, I think maybe when establishing a long-term outpatient relationship, it can be appropriate to introduce yourself as DNP when that can be explained. If you're in a critical care setting, maybe not. Yeah, but also I had no time in primary care. Like I said, 15 minutes, everyone came in, they were a hot mess. And I was like, the last thing I need to worry about is this. Uncle Sam G said, I'm Dr. So-and-so. I'm a nurse practitioner. That isn't a problem. You earned it. Reasonable minds can differ there. I'm just blatantly stealing Rick's tagline. We could think of a different one that's very similar, or maybe we can just give him all the credit. Matthew Ives, hello. Matt came to my stream earlier and saw me wandering around my Dreamlight Valley house. Thanks for being here. I'm still on the side of patients get confused enough, just trying to understand basic instructions. No need to confuse them with titles. Here. With other healthcare professionals, it can be useful, but for patients, go as simple as possible. Always. Simple as possible. Nate said, I don't think anyone should insist on being a doctor by patients. That's just egotistical, but it's fine to explain you have a terminal degree in nursing if you have time. If you have time and you figure out how to do that, please let me know. Because goodness gracious, how do you have time to do that? I barely had time to do like anything. Uncle Sam G said, it's confusing. If you say you're a nurse practitioner, they get confused anyway. I say I'm a nurse and they're like, thanks, doc. Exactly. I think it's confusing enough anyway, because tons of my patients, I never even included the word doctor. I just said, because people assume if you are in the room, you are treating them, diagnosing them and ordering things, that you are a doctor. They assume that anyway. Even if you walk in and you're like, I'm a nurse practitioner. I don't even abbreviate it. I say I'm a nurse practitioner. They'll still be like, oh, you're my doctor. I'm like, no, I'm not a doctor. I always clarify that. All nurse practitioners I know, like even if they have their doctorate, they'll be like, no, I'm not a medical doctor. Like I have this. I correct people twice. And after that, I stop correcting them. Well, sometimes they're even like, I know you're not a doctor, but you're my doctor. You know what I mean? So there's already plenty of confusion. Let's not add to it. Let's see if we can find some comments from people. Let me see. Jessica Manila said, you could use a doctor on paper for published work or when listing credentials, but I would not use it in the office because I think it takes away from our precious 15 minutes together with patients. Exactly. Other things I want to talk about. Amy Kunkel, I had to page an ARNP. ARNP is what we use in like Pennsylvania and maybe some other states. It's an APRN, Advanced Practice Registered Nurse. ARNP, that's what I am, and I advanced registered. I don't even remember. I hate it. I'm used to APRN. I was an APRN in North Carolina and Michigan, and I don't like ARNP. I think the order is silly. Obviously, I don't even know what it is, and I have one. And when he called back, he insisted that he was the doctor of that patient. He was a douche over the phone. I'm sorry. I hate people like that. I think as we discussed in the live stream where we talked about the provider versus physician, some people have a lot of pride in their they really, really like their name. Um, this is interesting. Thomas Brown, as a non-medical person, the conversation is incredibly interesting. For me, I typically just addressed everyone as a doctor's office as doctor until they specify otherwise, or unless they specify otherwise. Helpful. Yes, I totally see where you are because yeah. And this is I'm grateful. Thanks, Thomas Brown, for bringing this up because we can lose sight of this a lot, right? Because we don't necessarily know. We're like, I don't know where this, like, I don't know how this goes because I can't take myself out of the equation. This is just my experience from seeing a lot of patients. So this is helpful and also clarifies that it is confusing, right? Because you assume everyone is a doctor unless otherwise specified because it's just a hot mess. Must drink. Hold on. Yep. And like Mr. Midwife said, that is the problem. That is the problem that is the setting we're in. I just don't think that's the fight that we need to, I just don't know if it's going to be the fight we need to fight, all the day. Shane XM like, I like Under Physician because it has nice 1900s British vibes drama. I love it. Under Physician. Oh, prestige is everything. Unfortunately, most pre-med students think this way. I think some do. I hope we're getting away from that. I really, really do. Let me see. DOs are physicians. We literally have chiropractors calling themselves doctors. So I think at least in an outpatient non-critical care setting, it's essentially a free for all for better or for worse. I don't agree, but I get your point. OB Nurse Chelsea. Oh, hi, Fran. I can't tell you the number of times a patient is on the phone and hangs up when I walk in and says, the doctor is here now. I'll call you back. Lovely. 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 Just lovely. Mr. Midwife pisses me off. Pisses off nurses everywhere, almost as bad as the nurses sitting and playing cards comment. Yeah. 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 Pamela Perry says there's a huge difference between a GP and a doctor who's gone through residency. Yes. I'm assuming, well, GP is like a general practitioner. So that's actually a lot of people call their family medicine healthcare doctor, like physician, a GP, general practitioner. I would say there's a huge difference between a nurse practitioner and a doctor who has gone through residency. Yes. And that's why it's important to clarify and go through. We still have GPs. A lot of people I have found who are, I would say, like in their 50s and older, will always call their family medicine provider or their primary care provider their GP. They just always call it that. And that's usually a physician. Nate says, I wonder if Pamela's in Europe where GP is more common of a title. Yeah, maybe. Let me see. And I think those are the main thoughts. I think we had, if anyone wants to give more sides of, I know I was definitely heavily leaning into my, my bias there, which is like, I don't think this is how it should go. But let me know. Let me know if you have a strong other opinion and we'll read it really quick. I kind of got lost in, I jumped all over in the comments and now I'm lost and I'm afraid to go back, but we can go back and I always leave the live replays, the live chats on replay. So you can go back and read all of the comments. And usually, to be totally honest, I have my sister here and she stars all of the comments that I should definitely read because I have ADHD and I can't, I'm like, boop, 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 boop. And she's not here. So if things are chaotic, that's probably why. So I can't go back and I can't find them. So Mr. Midwife was helping me out. He's like, go look at this comment. I was like, okay, I will. And yeah, Chad and I rarely agree. So if you guys aren't familiar, Chad, Mr. Midwife. Oh, Merce Cal. Hi. Random live. Hooray from work. Hello. I hope work is going well. OB nurse Chelsea, mama nurse, all of these lovely humans. Nurse Scott, he's not here. We're going to have to yell at him later. He's probably studying. Are on my panel discussions that we have on Friday. And it's a very, I hope, well-rounded group, hopefully from all over. We have Nurse Adrian just to get like different avenues of different thoughts and lots of different backgrounds. So that's perfect. No, we agree on most things. I hope maybe when we talk about universal healthcare, I think we're gonna we're gonna diverge. It'll be interesting. Scott needs a note from his mother. He has missed too many classes. I know. What the heck, Scott? What the heck? Where are you? So we'll have to call him out on Friday and like mention something from this and see if he actually watches these. He better. I'm like, come on now. Come on now. Kyle Reeder says, in regards to patient confusion, what are your thoughts on ways to change it? If it's not important now, then when? When people have access to healthcare, I would say that it's important once they have access to healthcare. I think right now the biggest thing is we only have 15 minutes with you and people are not getting the care that they need, at least in primary care. I can't speak to other subspecialties, and the hospital feels very rushed a lot of the times. So we have to wait until we get to a level where we decrease hospitalizations, and we do that by promoting primary care and treating people sooner before they get super duper 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 sick. Because right now in our country, we kind of have a flipped model. We treat a lot of people in the hospital for conditions that could have been prevented a long time ago with primary prevention and with early intervention. But we don't have that because people can't afford to go to primary care for things when they're small. They wait until it's a huge issue and they land themselves in the ER. And yeah, primary care and preventative care. And that is the battle I would rather fight. You know what I mean? Right now, when we have 15 minutes, I have an hour of information I would probably like to give this patient, and not a single moment of it do I want to waste clarifying my role when I need to try to teach you how to completely change small things in a way that you understand and you understand why. And I do it in a way that you can actually do because you probably aren't in a situation that it is ideal. So we're going to have to get creative, and I have to do that in 15 minutes. So I think in the future with ways to change it, honestly, is through education and in the school setting. I think we do a horrific job preparing humans for real life. I think this needs to be part of the how to do your taxes, what is insurance, how to set up, what is a 401k, what is a what are different healthcare providers? What are the differences between, like, what happens if I get arrested? Civil versus criminal law. That needs to be in Adult 101 that we need to introduce, I don't know, somewhere in high school. In order, oh, sorry, I just bopped all of you. That needs to be introduced, I think, and really, really, really harped on. That's the only place I can think of. Like, make people take that before they can get their driver's license. I don't know, hold something again, hold something hostage so that they have to take a life class. And because we have to educate that way. We don't have time to educate in the healthcare system. We simply do not. Let me see. It's a liability. Pamela Perry says, it's a liability issue, though. People need to know who they're talking with and taking recommendations. Yeah, which is why I would just say nurse practitioner, because it's very, very clear, or it's clearer. They still really don't know who we are, but we're not introducing any additional confusion. There's been, Rogan P says, there's been huge strides in patients accepting nurse practitioners. This is true. It used to be that patients wouldn't see us and they only wanted to see an MD. Now some patients prefer NPs over MDs. Yes. This is also true. Hold on. We need to bust out the mints because my throat is like, it's dying. I'll tell you in a second. Oh boy. This one's not good. Sorry. We were at my neighbor's house for dinner which required me to socialize a lot and talk. And I also was in a lot of meetings all day for work. And my throat is just like not into it. It's like, let's not work anymore. Pamela Perry, I don't think it would take more than 2 minutes to clarify that, hey, I'm not a doctor, but I can still help you. 15 minutes of obscene. I know it's true though. Yeah. And I just don't have 2 minutes. That's the thing. And like, I just need to prioritize what is the most important thing. And at the end of the day, a patient understanding what degree I have doesn't change their outcome of care. You know what I mean? All it changes is my ego. It does not give them implementable change. So I don't think it's worth it. But if you do, that's you. You do you. That weird science guy. Mm. I once had an NP come in and say, hey, my name is Dr. Blank, and never even disclosed that they were a nurse practitioner. I only knew because I saw their badge roll. That's a big no-no. That's illegal. In the US, we only treat when you're damn near dead. Yeah, D&D. So yeah, we need to change that. Agree. As someone, Kismet, oh, thanks. This is helpful. As someone, I love all the like non-helpful healthcare perspectives because I think we can get in the weeds with it. As someone who's not in the field, looks to me that people making the medical decisions, insurance companies do not have a degree. This is the real truth that we need to get angry at because that is absolutely true. Insurance companies tell us how we can do our jobs, what we can do, what meds we can do. We have guidelines that we go by, and then the insurance companies throw them out the window and they say, try the ones that don't work first. And then you can try the one that you know does work. Have you failed 2 other treatments? It's like, why do I need to fail those other treatments when I know this one will work? And they're like, well, it's cheaper. Mm-hmm. Pamela Perry, everyone, Nate saying, yeah, you could get your license suspended for not specifying that you're a nurse practitioner. You're just a doctor. That's super skeezy. I would, Merce Cal said, I would estimate the lack of effective and repeated diabetes, type 2 diabetes and insulin education leads to major hypoglycemia and hyperglycemia episodes. Yes. Yes. I don't know what we're talking about on what topic, but I agree. It does. It very much does. And you don't have time to even educate about here's what low hyperglycemia, high blood sugar, hypo, low blood sugar. There isn't even time to educate like on that. So yeah. Mel, hello Mel. I should be studying, but I got an A on my first big patho exam. Yeah, that's exciting. Congratulations. That's amazing. Well done. I've never gotten an A on a patho exam in my life. So you are a rock star. Everyone claps for Mel in the chat. Mel is always chatting with us. And Mel, that's amazing. Yes, Rogan P. Yeah, Mel. Yay. And this is a good perspective. XXMO docs, Pamela Perry, and to you and I, that's not confusing that that a doctoral degree is different than being a medical doctor. And then this is a good point. And this is very, very true. And that's to you, that's not confusing. Now put yourselves in the shoe of a person who didn't graduate high school, or a person who's showing up to an appointment with their 3 little kids, or a person who is showing up to your appointment knowing like terrified because they do not like interacting with healthcare because healthcare has been historically very, very awful to them. So they don't even want to be there, but they need to be there because things are getting worse and they're nervous, or they are so convinced that they're dying that they're not hearing anything you're saying. So they're not going, it needs to be just as clear and simple as possible. And they don't care about you. That's the other thing. Like people, when you're going to the healthcare provider, they don't care about you. They don't, they don't want to learn about your degree in my experience most of the time. You know what I mean? What was Jassy J said, what was the purpose of creating advanced practice nurses? When did it begin and why? That's a whole different topic. If we have time at the end, we can talk about it. They started because there was not enough people to treat patients in rural areas and in the parts of the city that no one wanted to go to. So for particularly patients that were lower income, who lived out who lived out in the middle of nowhere. There were not physicians. And so they had nurses who were training a little bit more like under with physicians. And then they went out and they started doing the thing to provide resources where there were none. And then I think it started in the 60s. They started to actually, you know, get it became an actual thing. But I didn't pay attention in theory because I thought theory was stupid. So that's all I took out of it. There's probably a better answer. Someone who paid attention in school in that class, I was like, I only care about the stuff that's going to affect my job and being good at it. I'm not going to waste any brain cells on memorizing this theory crap. Some of you probably were better students than me. Pamela Perry says, I think nurse practitioner says it all. I agree. But if people call you doctor, that demands clarification. Oh, for sure. Yeah. And they will. And like I said, I corrected them twice. And then I was like, I tried. Farm girl nurse doc. Hello. Honestly, being a DNP has not made me be a better clinician. It has made me a better academic. Yeah, that's kind of exactly what I think. I'm like, I just feel like I would learn how to write, like do research better, be more involved in academia, do a research study. It's not going to, because when you get your DNP, you're not doing extra clinical hours like necessarily all the time in a clinic. You're doing them like academically. So like researching, but you're not learning additional things. Like what a wasted opportunity. We could use the DNP to like subspecialize. There's so many other cool things that we could have done with the DNP, but we did not because nursing, because nursing. Sorry if you hear mint sounds. This is not supposed to be like mouth ASMR. This is just me trying to get my throat to calm down. And Ty Riku said, I caught Nurse Liz live. Hi from my break at work. Hello. I hope the rest of work goes very, very fast and is not messy. The most I can wish for you. I hope it goes well. Let me see. We just talked about this. DSA, one of the main causes of physician exiting is insecurity. And insurance company are the culprits. It's just a super high pressure situation. We just did a whole panel discussion last Friday. I'll link to it down below about mental health in healthcare and how for residents especially, it's just abysmal. And I completely understand why. They are literally going through horrible, horrible things. Oh yeah, Mr. Midwife, Rogan P. If you ever want to be on our channel discussions, let me know. I feel like you already are. But yeah, go for it. Email me. Let me put my email in the chat. earthlovington.com. You have passed the test. We accept you. Welcome. Come aboard. Welcome. Come on. Let me see. Infinite Mind said the GI office had a form that asked for who the referring doctor was. I wanted to make sure she received the credit that matters, but I wasn't sure if it was appropriate. Oh, there's probably a precursor question to this. Oh, met once with an NP for abdominal pain. She worked in an office with physicians and NPs. She referred to me to another GI doctor. GI office. A lot of the times the forms will only say nurse or doctor. It's something that would be lovely to change. I would love those forms to say healthcare provider. And depending on the state that you live in, you can sign them or not. Like I could not sign physical forms for police officers in my city, even though I did the physical. And I was their healthcare provider. And I couldn't sign those forms because it specifically said medical doctor. So like DOs, I don't even know if DOs could sign it, but like I couldn't sign it. I had to give it to the physician I worked with and she had to sign it and then we'd be done. Even though, don't tell him I did the thing because I was their healthcare provider. Like forms are weird. I could sign the school's ones. The school allowed a nurse practitioner to sign it, even though it said go get your physician. So that's something that does need to be changed. And that is a huge issue with a lot of healthcare and health insurance type of things is it specifies physician and doesn't let you do things. So like I could not order diabetic shoes for my patient, but I could order them a CAT scan and like inject them with all sorts of things. Like I could do I could prescribe many, many drugs, controlled substances. I could do all sorts of things, but I can't order shoes because Medicare said that I was not qualified to do that because they specified it had to be a physician. So that's a huge thing that we're up against. And just one more thing that we can get mad at, not here. And Jill Ladani, it was, I can do, she said, they said, NPs in New Jersey can do a physical exam. We could do a physical exam. There was just a form that if you were a police officer, every year you had to get an annual physical. And on the police officer form, it literally said physician's signature here. And you could not sign it as a nurse practitioner by law. That was like a weird thing that we had there. And yes, I wish it, yeah, exactly. Chad, it should change it to like delivering provider. Yeah, something like that. When I sign a birth certificate, it reads delivering physician. I hesitate, but nowhere else for me to sign. Exactly. It should say like what, delivering provider? Yeah, like why? We need to work on it. Not the dreaded provider. I know that was quite the conversation. Mel said, did you get my email? Probably from 6-ish weeks ago. Let me go back and check. I probably did. I will ask Rachel. She pre-reads all my emails. So she organizes them for me and then dictates them to me because I can't sit down and read. So she sits there and dictates. So it may have gotten lost in that shuffle. Friends, if you ever email me and I don't respond in like a week, just email me again or like resend it and be like, just boosting this to the top. It is not personal. I have no organizational skills. I have a lot of skills in life. Organization and responding to people, that is not one of them. So if I ever don't respond, please don't assume that it is me being like blowing you off. Please assume that it is me being an unorganized goof and I suck and I apologize. I wish I could say I'll work on it, but that has not happened yet. I am. I am not organized in this way. I'm choosing to see it as a feature of myself versus a curse. We're trying. Okay, let us open it up to just some general good Q&A times. What thinks we? What thinks we? Michaela asks, I think that Liz needs to hire a personal assistant. That is my sister. My sister works for me full-time running my YouTube business. She deals with all the people that email me. Not like, I don't mean like you. You're not the people. Like if I have sponsorships, she helps me with that. She does all of my business stuff, taxes. She, pretty much everything on the back end she does because I don't have time to do that and to have a job. And yeah, so if she she is my assistant and she tries her best and I ignore her a lot of the time. So it's not her fault. Like I said, it's a personal problem. It's a personal problem. Well, Scottian. Nurse Scott is here. Hello. What did I miss? We were talking about you earlier. We were talking about you earlier. Norley, thanks. Yes, send me Chad's. We did talk about that, so I'll let her know. But yeah, Scott, we were talking about you. We assumed you were maybe studying. And we discussed how you were going to be in trouble for not showing up and you would be quizzed later on what you missed. So you best go back and watch in 2 times speed. Welcome. Your ears were burning. They should be. I hope whatever you're doing was fun, but it doesn't sound like it probably was. I hope you feel better. Oh, Marcel said, what was your favorite education to provide? I always love covering diabetes education. Yep, it was that. I loved having conversations about diabetes because you could go back. I loved catching it early when you could go back and I talked about diabetes. I was like, okay, so diabetes, your body can't, we'd talk about how the insulin needed to reach out and that was what was going to go in, you have a bunch of sugar floating around in your body, right? Sugar molecules are huge and they act like those pokeballs that fall from the trees that are like really spiky because they're a big or like molecule and they're all sharp and they cut things up as they go. When you have a little bit in your blood, that's good. That's our brain food. That's our muscle food. If we have too much, then it gets traffic jammed and it gets congested and it starts to hurt things because it's all trying to beat itself up through the bloodstream, right? And if we don't, if we do certain, if your body is starting to get insulin resistant, we talked about that, then you don't have the insulin to go out and grab the sugar and pull it back in. So we prevent those traffic jams. And long term, we're going to run into problems with our kidneys because the pokeballs are going to run through our kidneys and it's going to go down to our tiny, tiny, tiny veins in our toes and our fingers. And that's why you hear about people getting numbness in their toes and their fingers because it's getting down there and it's poking everything up and it's damaging those tiny blood vessels, also in your eyeballs. Let me just go down like that. And really making them understand what this is and why, and super duper simple things that they can do to start reducing it. Pairing carbs with protein was a huge one. Just move your body. It doesn't have to be hardcore exercise. Patients are usually terrified of the word exercise. I'm terrified of the exercise. You know what I mean? Like, just say, hey, do you have a can of soup in your house? Could you lift it like this 5 times on a commercial break? Every commercial break, do you have stairs? Could you climb up the stairs twice for me? Could you go wander around your house in a loop 3 times? Could you go on a nice walk? Could you just go outside on your porch if you don't have an area where you could be on a walk? And, do you have a pathway like along your apartment building where you could just walk in the hallway? Things like that, like coming up with reasonable plans with them and then seeing the improvement and watching them understand why you don't just say, like, hey, you need to stop eating this to lower your blood sugar. So that was easily my favorite conversation because then they usually walked away from there like, oh, like I get it now. And you're like, thank you. So I loved talking about diabetes. I have often thought that it could be a good time to, or like it could be interesting to go and go back and become a diabetes educator, but who knows? Who knows? I would love to talk to you about diabetes education sometimes, Cal. I think you could probably explain it really, really well. And I love hearing how other people educate so that I can steal things from them and then use it. Brittany Gaffney, I totally missed the beginning of this, but I'm a PNP, a pediatric nurse practitioner who has her doctorate. And I do not go by Dr. X. I have a colleague who does the same credentials that does, and I feel like people judge her. Well, we all know I agree with you. And, but to each their own. I think it's just more clear about that. Yes, it's all about the patient and their perception, not me. Exactly. That's how I feel. Exactly. Your profile picture is lovely. Shane, unnecessary and helpful API models. Ooh, that's terrible. Did we figure out what Scott was doing? Scott, were you doing something fun? Best exercise is a walk. Yep. CT with contrast but no shoes. Yes. Yes. It's ridiculous. I'm like, just let me order shoes. And I couldn't order physical therapy, which is like the least intervention, like least invasive thing ever. Yeah, I figured, Shane, that was an earlier question. Once again, when I don't have someone to mark my questions for me, I'm like, I'm going to click on this one and see if it makes sense. It does not. It does not. Oh, good. Nurse Scott was able to take a break and take the dogs to the park. He has 2 absolutely beautiful little puppies. That's awesome. I hope it was nice. I hope it was nice out. I hope it was peaceful and relaxing and no creepers approached you. And that you found a nice, handsome, maybe a nice, handsome man came and was with also walking their dogs. That's my dream for you. And they said, would you like to go to a coffee shop while you study? And I just stare at you. You're beautiful. That's my hope for you. I hope that happened. If not, well, there's always tomorrow. Let's see. My answer is not in the clinical setting. No, yeah, I couldn't order PT, Mel, which was super duper stupid. They were like, well, you can order oxycodone, but you cannot order physical therapy. No, no, no. Pamela Perry said, I would love to know more about how you educate children on diabetes. I work with them in schools and it's cray-cray if they eat foods high in carbs and family dynamics. Kids are so hard because you really have to have the parent involved because kids, they are not necessarily in charge of what most of the time, what food that they have in their home, right? They are, you can explain the same things to them. I would try to tell them, when I did a whole diabetes, I did a lot with kids with diabetes, in nursing school, a lot. And, we did a lot of talking about, I worked with a diabetes educator and we did a lot of just talking about like, when you have snacks, we worked a lot with like, they blood sugar snacks in our office. And that's actually something I brought in with me into practice as an NP. Is I had a whole box of snacks of all sorts of different things, or wrappers from different things. And we would go through and we would be like, okay, what do you have in your house? What are you eating? And I did this all the time with my kids, my peds patients, and especially my adolescents and my young adults. And we'd look at the box and we'd say, oh, I have that, I have that, I have that. And I said, let's make some pairings that we could put together, right? Things that are going to keep you fuller for longer and help keep your blood sugar a little bit more stable, right? And that was something really, really tangible because they could see the foods that they were actually eating. And we could even have conversations about like, hey, if you have this candy bar, what could we pair it with so that this candy bar, if that's all you have access to, is actually going to keep you fuller longer? Because we can do that fairly easily. But if you just eat the candy bar, you're going to crash. But if we pair it over here with, a little bit of peanut butter, an apple with peanut, something like that, then we can actually keep you fuller, some cheese, some nuts, then we can actually keep you fuller longer and going from there. So that was my favorite thing, was something that they could visually see because they had a hard time understanding it. And then I had a little jar full of my pokey tree things, like pokeballs from the trees. And I would call them my pokeballs from the trees. And then they would laugh at me, especially when they were little. I was like, you know what a pokeball is? And then I would show them my little jar and they're like, that's not a pokeball. I'm like, oh, I'm so silly. You're right. That's not a pokeball. I call them pokeballs. Anyway, I loved Pete's. They basically just thought I was dumb, but they remembered and they listened. So that was my method. Let us see. I would love for schools. I agree, Rogue. I would love for schools to be educated on diabetes care for children. If I had to care for kids whose parents couldn't manage their care, they'd end up in the hospital a lot. Yeah. And a lot of those kids do end up in the hospital because the parents just are not there. You know what I mean? It's not there. It's really, it's just hard. Let me see. I don't think my dream for Scott did not happen. He said, no, that was my dream too. But alas, no. It was nice and relaxing. And my boy, then I needed it after yesterday's patho exam. Oh, let us know how they did. Oh, let me know how they did. Oh, yes. Okay. So that's what they're called. Those are sweet gum tree ball. Sweet. It's too late in the day. I'm too immature to read the sentence. And they drove my grandpa crazy every autumn. He finally had all 6 of them cut down. I think they're kind of fun. We used to throw them at each other. They'd get tangled in our hair. It was exciting. Nut butters and crackers are diabetic break into case of emergency. Yep. Something like that. Something like that'll just like pair you, protein and carb, friends. Just pair those and you will be fuller longer. If you can get some fiber in there, bonus. Yeah, titty fish is when you I can't with that name. When I read it out loud. When you say pokeballs, I think of pokeballs. Yes, that's why I would call them that. Like, I choose you. I can't be the only one thinking about Pokemon every time you say that. I always try to get my kids to think of that because they we would think about like Pokemon and then we could connect over Pokemon. And then they thought I was dumb. They were like, oh my gosh, you know what Pokemon is? You're like so old. Like, I play video games, loser. And then we could connect over that. So I would usually purposefully use Pokeballs so we could pretend I was confused and then they could laugh at me. And then we could talk about Pokemon, unless they were like really cool. And they were like, what's Pokemon? And I was like, well, this went south quickly. Nurse Chelsea said visual aids are great. I draw vaginal canals and cervix and fetal heads for patients all the time. Yes, exactly. I got you. I got it. It was vaginal canals. Vaginally canals. I like that though. It's a vaginally canal. Yes. Whose parents made breakfast and lunch? A lot of people, they don't have their parents making them breakfast and lunch. Let me see. Gabby Parr said the poll is hard to answer. If you're a master's level NP, no, but if you're a DNP, then of course you earned your title. We have a other opinion, which you are absolutely welcome to have. I just think it's unclear. As we have said, Pokemon is huge with kids in Hawaii still. Good. That brings me comfort. Michaela S., as Abby Sharp, YouTube dietitian, would say, with the hunger crushing combo, protein, carbs, and fiber. Yes, exactly. Exactly. She's a great channel as well. If you want to go check her out. She and I agree on most things. The only thing she and I differ on is she is pretty anti counting calories no matter what. And I think in patients who are not at risk of that works for some people, right? It doesn't work for people who are at risk of an eating disorder. It doesn't work for a lot of other things. She's very, very, very against them. But I have seen that work a lot for patients who need and like apps that as long as you're not at risk for that behavior and you're not identifying that and the app comes along with a lot of instructions from your provider, it can be helpful to learn the caloric density of some foods, like because a lot of people don't have education on that. But other than that, Abby and I are like, I like her. I like Abby Sharp quite a bit. Great channel if you need something educational and entertaining. Um, Let me see. Titty Fishes says, I love pediatrics. That's my goal. And I can't wait to be a pediatric nurse. Then I can continue to be hip and cool with the kids while I still watch Saturday cartoons, playing video games and loving colors. Yes. Yes. Absolutely. It's wonderful. Yes, it is a wonderful field. It's heartbreaking at times to learn how resilient children are. I learned so much from my time there. I agree. Children are wildly resilient and they usually get better, which is awesome. And so much less. I actually found peds less heartbreaking than adults because kids usually do get better. When they don't, it is absolutely devastating. But those kids are like so stinking resilient and they're just so funny. Okay. Tristan Barton, I'm going back and answering other questions really quick. Is there a requirement for a DNP now, or can you still do an MSN to become an FNP? Covered that a little bit ago. Short answer, again, if you missed it, was you can still get your MSN and they want to phase it out by the time it's 2025. This will not happen. They will push it back again. They've pushed it when I was in school. They wanted it done by 2020. Before that, they wanted it done by 2015. Now they're saying 2025. The schools do not have the capacity to do the doctorate. And they pay too much money into the different like organizations and lobbying things. So they won't switch it because they want their money. It just won't happen. But they can keep saying they wanted to. How long have we been saying? Not we. I could care less if people have their bachelor's or their ADN. They've been trying to get everyone over to the BSN forever, and it's not happening. Because we have such a need for nurses and ADN nurses do an amazing job. They've been trying to mess with the LPN forever. And again, it's not going anywhere because LPNs are very needed and do an excellent job. And it's a mess. Cody said, Liz, do you think in the future, say 10 years, will hospitals require BSN and ADNs phased out? Nope. I think we will all still be here. All still here. I think we're, especially now, a lot of they're kind of desperate for people. Really need people. So I don't think it's going anywhere. An ADN is far, far more accessible than a BSN. You can do them at community colleges. They are more affordable. The hours are more flexible. The training is better, in my opinion. It reaches a larger number of opinion and a larger number of people. They allow a lot more diversity in the field. They allow such a better, they're, I think, more clinically focused. I do not think we will get rid of the ADN because it serves a huge, huge population of nursing schools who there's not enough teachers. We don't have enough teachers to make BSN programs. And if we chopped out the ADN, there's just not enough nurses. There's already not enough nurses because healthcare systems don't retain them well. So there's enough nurses. There's just not enough that want to work. So they can't afford to do anything like that. We did a whole video on, are there enough nurses? And the answer is there's enough nurses. They just won't keep them. They won't pay nurses decently. So I'll leave that. You can check that out in my Nurse Practitioner Reacts video. But no, I think you'll still have ADNs in 10 years. Jassy J. What was the purpose of creating an advanced practice nurses? Oh, we talked about that really quick. Dustin Lamb said, what do you think being an NP will be like in 20 years time? How do you think it will change? I don't see it changing that much. Maybe that's depressing, but I think there is so much conflict within nurse practitioners and physicians and within nursing itself that we're spending all of our time fighting with each other instead of fighting the actual issue. I think it'll probably be, if anything, a lot more legislated of what exactly you can and cannot do. Cause right now it's kind of like, well, as long as you know, or if you live in a like a state where you have a collaborating provider, it's kind of the Wild West because they're like, well, as long as like, oh, as long as everything's fine, like as long as things seem fine, we'll just sign off on it. But I think if anything, it's going to get worse, more litigious, more lawsuits, more like very outlined of what you can and cannot do because everyone seems hell bent on fighting with each other instead of fixing the system as a whole. So I guess we're going down that path. Um, there we go. Pamela Perry, our magnet hospital is still a thing. Unfortunately, magnet is still alive and well. Magnet, if you don't know, is like a classification that a hospital can apply for if they have a certain percentage of nurses who are bachelor's prepared, and you have things like committees. I think it's basically the hospital has to pay a lot of money in order to they come and evaluate the hospital and decide if it's to show nursing excellence. Nurses get nothing out of it. The hospital gets paid. They pay a lot of money to get recognized as a magnet hospital so that they can advertise it that way. And it blocks out a lot of the nurses from being able to work there because then they won't let ADN nurses, prepared nurses work there. They usually won't let LPN nurses work in the hospitals, at least not on the floors. And it just blocks out a huge population of the really good nurses that we have. And it's still a thing. They pay a ton of money. It's a who knows who club. I hate them. I hate Magnet so much because I think it's so stupid. Yeah, they will be like, titty fishes will be like, oh, thank you for still loving LVNs and LPNs and ADNs. It makes me sad when I tell people I'm going to nursing school and I tell them an LVN and they will be like, when are you going to be a real nurse? LVNs are real nurses. Agreed. LVNs, I will continue my education, but it makes me sad that people look down on those with an LVN or ADN. We have a real big, if you haven't noticed, ego problem in healthcare. We really like to remind people how much they have had in education and then how much we have had and how we're better. And because I went to more school than you, in case you haven't noticed, we're really that. And I learned almost everything I knew as a new grad nurse from amazing LPNs who are very much nurses. And then since I had my RN, ended up having to sign off on all their charts that they literally helped me write because I didn't know what I was doing. And I hate our system. Hate it. Mr. Midwife thinks we'll go more towards a European model of nurse practitioners. I'm not familiar with that, but I would not see it. A few miles said getting my ADN. I have a bachelor's in another field. BSN was 60,000 in the 80 and was 5,500. Exactly. Case in point. Nurse Scott said in 20 years, the NP scope of practice isn't going to shrink and there will be plenty of resisting to expanding it much. So Nurse Scott is usually much more optimistic than I am, and case in point here. So I am not a future teller. It very much, the scope of practice may not shrink. I think it will, but maybe it won't. And I think no matter what, is going to be a lot of resistance to a lot of things. I think the American Medical Association is very powerful. They have a lot of money, a lot of money. They are entangled with hospitals who also have a lot of money. They are well connected, and physicians stick together. Nurses, we fight amongst ourselves as shown, but physicians really do at the end of the day toe the party line. And the AMA, I think, is going to come down. They're already attacking nurse practitioners hardcore, and we can't even get along within ourselves. And that's why I think nurse practitioners we're going to have issues, is because we can't stop fighting amongst ourselves within nursing. And I think the AMA is just going to come at it and like point all sorts of yikers things at it. But that's just, I'm not an optimistic human, in case you can't tell. Lots of other people who are much more optimistic probably have different opinions. The weird science guy said, I feel like if an NP wanted to be called Dr. So-and-so, they should have gone to med school instead. Hot take. Can't say I disagree, but unless you're in a different setting, then that's fine. Let me see. Magnet hospitals. Yeah, magnet hospitals are huge into like discrimination, and because it is more, you get a hospital filled with people who a lot of them have their BSNs, and in that, if you have your ADN, usually that is a much better balanced population of humans versus a BSN, which is a lot of people who look like me. And like you have a hospital full of basically white people. Or people who came from a very middle class, whatever. Not only, I'm not, this is like not over, everything, but in my experience working at hospitals who are not magnet, who let people who were ADN nurses in, people who were LVN nurses in, it was a lot more well-rounded. That's all I gotta say. Kiriki Valkin said, referring to magnet hospitals, I work at one. We have LPNs on the floors and step-down units due to the shortage. They come in, they get phased out. It's a cycle. Yeah. A lot of our ADNs, when I worked at a hospital that was magnet, they would hire you in, but you had to go back within the year to get your BSN. And you had to prove that you were already enrolled when you got hired. And they made all their LPNs leave the hospital. It was very sad. Or get an RN, and most of them were like, I've done this for like 30 years. I don't feel like doing that. Like, I'm going to retire in 5 years. I guess I'll go to a clinic and then they left. And now I'm like, wow, that was such a huge resource that you just let go. But again, let's just fight. Let's just fight. The AMA Angela said the AMA Stop the Scope campaign is so problematic on so many levels. To be honest, I'm biased as an APRN. Yeah. Oh, the Stop the Scope creep is, it's a lot. It's a mess. They have billboards. They have, it's a mess. It's a mess. And Pamela Perry, it's not just like, oh, it's only like, hospitals, but primarily hire white people. Like, it's just the system overall. You know what I mean? Like, there's going to be exceptions, but yep. Brittany G says no one wants NP to have full practice authority because they think we're coming for their jobs. Yes. No, we're doing the jobs that like you don't want to do. No, you don't have enough people going in for to be working primary care because med school is so expensive that there's no way to pay off your loans as a primary care person. So nurse practitioners are filling that gap. It's like, I'm not coming for your job. This job is open. Sit down, calm down, American Medical Association. You all want to be surgeons. And so sit down. So yeah. All right, friends. I think those are most of my thoughts. It's 10:15. We're about an hour and a half. We should probably wrap up-ish. Do we have anything? I do the pap smear so you can be in surgery, Mr. Midwife. Yeah, literally. You go make the money doing the surgery, and I will sit here and do the pap smears. We'll do the regular routine stuff. And I think that is how it, in my mind, in a good system, like goes. I as a nurse practitioner in primary care can do like 70% of the primary care things, 70 to 80%. And I can do them really, 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 really well. Right. But it's that extra little bit that I really need the extra education on in the residency. And so when I have questions or I'm just not sure, I want them to look at something, that's when we push over. I'll do the pap smears. You go do the, I don't know, biopsy, whatever, majiggy thingies, and look at that and do that. We'll see. Titty Fish said I was scared of going to nursing school. I was 18 because all the girls I went to high school with were so mean, racist, ugly, and ultra religious. Yeah, nursing, there is that, but there's also not that. There's cool people within nursing. There's always within everything. There's some interesting. I hope it becomes more diverse and accepting of others. Me too. I hope we realize that you can be a nurse. It's slowly, I think, changing the tides ever so slowly that like, wow, I can have tattoos and be a good nurse. Wow, I can have blue hair and be a good nurse. Slowly, some people are realizing, wow, I can be attracted to someone of the same gender and still be a good nurse. We're getting there, slowly but surely. We're rounding the corner of like, wow, what a thought. I could be a dude and still be a good nurse. We're getting there. We're going to get there one day. Maybe. I hope. I hope. Good. And Jiladani gives us hope. My program is a diverse ABSN. That's awesome. Love to see it. Love to see it. that is, I don't think, the norm, but I love that. Um, Let me see. I'm glad bullying. Justine Tarot says my cohort is currently very diverse, except mostly women. All very nice. Bullying is dying out. I hope so. I very, 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 very much hope so. I would love to see bullying die out. It's kind of alive and well still on the floors, and within nursing, and within nursing school teachers, and within hospital administration. But let's go. Good. Lots of people saying they're in a very diverse ELMSN program in different places. So that gives me hope. I hope that people are nice. I hope that people are nice and just kind. I hope. Home here has a alternate viewpoint. If they have a DNP, they should definitely use the doctor title. We can go back to the beginning to hear my thoughts on all of that, but it's good to see diverse opinions in the comments. Nora Lee said, I'm a bit scared to be a sapphic trans nurse, but I hope there will be a large enough need for nurses that they'll have to overcome their bigotry and hire me. I wish that they could just hire you because you're awesome and they could see that. But I hope either way you get hired. But I hope it's because they see you and they're like, oh, wow, you're cool. Let's hire you. And that it has nothing to do with who you like, how you represent yourself, who you are. You know what I mean? Just that you're cool. What guys, what guys can be a nurse? Heaven forbid. Yes. Imagine. And I have tattoos too. Now you've done it now, Norlia. Before it was fine, but now the tattoos, there's simply too much. Didn't you know that if you have ink in your skin, it makes you a bad nurse? It's like a chemical reaction. It does something. Don't even. Oh. Titty Fishes, I said, I love my cohort. We are primarily much all people of color and we are very diverse from backgrounds. That's awesome. But it's a more poor school. Sadly, the big known schools in Texas are primarily white. Yeah, just Mr. Midwife Norlia. My only question, can you do the job? Okay, you're hired. Oh, pretty much. Norlia, one of my tattoos says death is just around the corner, so I hope I can just wear sleeves. Can you imagine? You're wearing that and you're just like pulling it down and showing people. You're like, they're like, what do you really feel about this? You're like, and just like walk out of the room. That one might be one that you do want to hide a little from your patients. I'll be like, I'm not that nurse. Oh, that's amazing. Just like scare them. Don't work hospice. Oh my gosh. Only if they piss me off. Do not make me bring out my tattoo. It has curses within it. Like scare people and be like, oh, if I touch you. Oh my gosh. I love that tattoo idea. I honestly do too. And like that's something that like I feel like my husband would get that because he's super into like the memento mori, like death. What is that? Remember death to like focus yourself. I don't know. And like remember that like we're all gonna die, which to me, I'm just like that sends me into an existential spiral. Like and for him, he's like, oh my, like that centers him. I'm like, okay, you do you, dude. But that kind of sounds like that, but I really I love that yours is death is around the corner. That is way better than memento mori. Just saying. Matthew, I'm sorry, I have some bad news about your test results. We need to come up with a positive one on the other side. Oh my gosh. Yeah, and it's memento mori and also helps me with SI. Yeah, good. If it helps you, that's perfect. No need to rush it. It's coming. There you go. I'm glad you're staying. And yes, it will happen when it happens. And we appreciate you here and you sharing you with us. But oh my gosh, that is that was funny. That was what I needed. Best tattoo ever for that field. Yes. Oh, so true. Okay. On that wonderful laugh. Oh, Mel said, as a patient, seeing that tattoo would have cracked me up, including the times where I was very critically ill, but probably not the norm. Yes, there we go. And I can do hard things could be the positive arm option. I can do the hard things. Here we go. But that's awesome. Perfect. I feel like we might have to steal that, Norlia, if you're okay with it, and one day make that like a sticker. Um, our sticker for our water bottles or something. Oh, that was funny. I'm gonna write it down. We'll give you all the credit. Let me know if you're okay with me using it. It might be funny. Um, oh yes, Titty Fishes says hit the like. Oh, hit the like button and Rogan P. Thanks. Hit the like button and an odd number of times to do compressions. If you do compressions on the like button, like she said, an odd number of times, it does help the vital signs of the video and it tells YouTube to send it out all over. Or you can leave a comment or share it with people. Liking is just so much easier. And yes. Oh, fake tattoos. Fake tattoos. Hang on, I need to write this down. Can we make fake tattoos? We have to get Norlia's proficient first because I don't want it to seem like we're profiting off of anything, that we're being facetious about it. If you know what I mean. Death is right around the corner. Okay. Tattoo and sticker. Perfect. Perfect. All right. Hopefully there's true response. And she tells us if she's okay with us using this as a potential brain idea. Because I want the sticker now too. Okay. Friends, thanks for joining today. Thanks for having excellent conversation. We kept it very, very, very. She said it's from the Addams family. Okay. Let me write that down. Addams family. Addams. Vivimus. You're too smart for a Scot. That's like Italian or something. Latin, maybe. Addams family. I'm going to read this note tomorrow and I'm going to be like, what is happening? What is happening? But seriously, thanks for having this conversation. I anticipated it getting a little bit uglier, but I think we were able to have a very civil conversation on both sides. Obviously I was very biased in it. But I tried to entertain other options. Obviously I'm only I'm right, but just kidding. You can be right too. There's no right or wrong here unless you live in a state that has a right and wrong. Then there's a right and wrong and you should do that. Liz, bias? No, I'm very, very most middle of the line person there ever was. Not at all. I don't think you can be a middle of the line person if you have a YouTube channel. Then you wouldn't have anything to say and it wouldn't be any fun. Right? The world would be so boring if we were all middle of the line, unopinionated humans. And I'm glad I have some opinionated new people out there with me. So thanks for being out there, friends. I appreciate you. This is a great conversation. I am excited to go back and read through all of the answers that you guys have. Yes. And we keep Scott around because he's very grounded. Very, very, I love you. My favorite nurse channel. Oh, thank you. I appreciate you. Thanks. I like my glasses. They're very heavy and they keep sliding because they're heavy. And so I need to go get them like tightened, but I'm worried if I get them tightened, they're going to hurt my head. So it drives everyone that I know crazy because I keep pushing them up and it drives me crazy, but it also drives other people crazy. But I'm just scared that if I go and they tighten them, when you get your glasses tightened and they just they hurt your head. And I just don't have that in me right now to have my glasses hurt my head because then I have to stick tissues behind it and then I look funky. And it's that. And you are all my wings. Scott is our anchor and you are all my wings. I love this. You're a great group of people and I really appreciate you. I hope you all know that. Rogan P, email me. Mel, email me. I forget who else. Someone else I was supposed to connect Chad and someone else will work on it. We'll get there again. We'll get there. All right, friends. I appreciate you being here. Thank you so much for being my people. You're the best. I hope you always remember that you, my friends, are not alone. You have a whole bunch of other cranky people right here with you. You are more than enough and you can do hard things. Until next time, my friends. Au revoir. Norley and Chad. Thank you. Yes. Writing it down right now. Got it. See you later.